Welcome to the NAGY Orthodontic Care channel. Let's take a look at the tools for braces home care. Orthodontic toothbrush, interdental brush, dental floss, floss threader, braces wax, rubber band tool, hygiene guide. Use short, gentle small circular motions. Clean the upper and lower parts of the braces by holding the brush at a 45-degree angle. To clean the chewing surface of your teeth, hold the bristles perpendicular to the surfaces. Brush the inner surfaces of your teeth the same way. For fresher breath, be sure to brush your tongue too. Use the brush to remove plaque between your braces, between the two brackets and under the wire. Hold the proxy brush parallel to the teeth, and gently move the proxy brush up and down, repeating this step for each bracket. Use the interdental brush to clean the gaps between teeth. Take your back teeth for example. Bend the brush head for the back teeth. Before use, make sure that the brush head is smaller than the gap between teeth. Insert gently between teeth. Brush back and forth several times. Take a 30 to 45 centimeters length of dental floss. Wrap the floss around your middle finger. Then use your thumb and forefinger to control a 2 centimeters length of floss. To replace a clean piece of floss, wrap the floss around the middle finger of both hands once in the same direction. Pulling the floss back and forth with your fingers tightly. Slowly slide it past the point of contact between the two teeth and into the gap. Slide the floss up and down against the neighboring surface of one tooth several times. It can effectively clean the plaque. After cleaning one side of the tooth, slide the floss up and down against the neighboring surface of the other tooth flossing between each tooth. Finally, pull the floss out slowly. Control the length of the floss by the centimeters, as close as possible to the tooth to be cleaned. If the distance is too long, it will be difficult to control the floss. Don't pull too hard over the neighboring surfaces of the teeth. Pull the floss against the side of the tooth. Otherwise, the gums will be easily hurt. When the floss is pulled to the end of the gums, it's not actually in place. There's actually a groove between the gums and the teeth. When flossing, you can slide the floss against the surface of the teeth and into the end of this groove. Although it looks like the floss is cutting through the gums, you just slide the floss in slowly. It won't cut your gums. On the contrary, if you don't pull the floss into the groove, you can't clean the space between the teeth. The plaque builds up and causes periodontal disease. If your gums bleed when you floss in the right way, it's probably because you haven't flossed for a long time. Plaque builds up on the spaces between the teeth, which makes the gum swollen and inflamed. When the floss touches the inflamed gums, the gums bleed. Bleeding gums can only be prevented by removing plaque from the spaces between the teeth. Pass a piece of floss through the loop of the floss threader. Pass the tip of the floss threader through the braces. Lead the floss into the bracket. Continue flossing. During orthodontic treatment, the brackets of braces can easily scratch the mouth. The use of braces wax can effectively prevent injuries. Take a piece of wax and roll it into a ball with your hands. Gently cover the surface of the brackets. Press firmly and evenly. Food-grade wax does not irritate the mouth. Braces wax can effectively solve the problem of braces grinding.